If you or anyone around you is above 60 and is often disoriented, have difficulty in remembering recent events, constant mood swings, and impaired speech, writing or reading, then it is time to see a doctor, as these are symptoms of Alzheimer's. Alzheimer's disease is a progressive neurological disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest task.
Always begins with memory loss, but not when you just forget things once in a while. It's when that person starts forgetting things all the time, to the point where the person starts repeating questions, asking the same thing he just asked 1 minute ago, asking it again. So patients lose short-term memory first. And often people don't diagnose it because they think, well, mama is just getting old. But the truth of the matter is, if that memory problem is occurring all the time and it starts to interfere with the person's ability to do the things that he or she would normally do, then you have to be worried that you are developing a condition like Alzheimer's disease. Ultimately, it progresses. It begins with memory and then it starts progressing slowly over time, to the point where the person is really no longer able to care for himself, no longer able to speak, no longer able to even walk in some cases, might have difficulty controlling oral secretions, difficulty really maintaining any form of hygiene or upkeep without being dependent on other people to provide the care for him.
Causes of Alzheimer's, according to Jide, a professor of neurology, are poorly understood, but it says some conditions could increase the risk of the disease.
We don't know the cause exactly, but we do know that there are certain things that will increase a person's risk of having it. The first, there's nothing we can do about it, and that is age. It tends to be a disease of elderly people, usually occurring above the age of 65, but it can occur earlier. And for every decade, every decade after age 55, the rate of Alzheimer's disease doubles. 2, tends to affect women more than men. 3, if you have someone in your family that has exhibited this progressive memory loss and decline in mental function, then it's important to have that diagnosis made, because if a father, a mother, a brother or sister has Alzheimer's disease or a form of dementia, the risk of you getting it is actually higher than other people. The other thing is diabetes also has been shown to also confer higher risk of getting this disease, and also smoking has also been shown to confer a higher risk of getting this disease.
Experts say Alzheimer's vary in severity and accounts for 60 to 80% of dementia, a general term for memory loss and cognitive decline.
The mild stage is really just memory, and so an individual just forgets over and over again, repeats himself, inability to really recognize familiar spaces. So mama or baba goes out and gets lost. They can't find their way back home. In the moderate stage is when the behavioral symptoms become more intense. This is when the caregivers almost give up, because the person becomes paranoid. As the disease progresses, then you enter the more severe phase, and that's when usually the person really becomes unable to function independently at this stage.
The neurodegenerative disease first appear between the ages of 65 to 70 in most cases, but medical experts say the disease is not a typical part of aging.
People just tend to overlook these types of symptoms because they think it's part of normal aging. But the truth is, in normal aging, you still should be able to care for yourself, function independently. If you have memory loss to the degree where you cannot function independently, that memory loss is usually a problem.
They also say the disease can lead to death, as the average life expectancy following a diagnosis is between 3 to 9 years. Is there a cure for Alzheimer's?
The disease is fundamentally incurable, although there are these symptomatic treatments that can improve the quality of life over a short period of time.
How can it be prevented?
We know, for example, that being cognitively active, being cognitively stimulated, and not being cognitively idle. You take up a new language when learn a new language when you're getting older. If you say Yoruba speaking, learn Igbo when you're getting older, learn Hausa when you're getting older. Just learning, keeping your mind active and sharp, and always challenging your mind has been shown to have some protective effects in reducing the risk of Alzheimer's disease.
Experts conclude that a healthy lifestyle that includes proper diet and regular exercise may help support brain health and prevent Alzheimer's.